So the view of immunity as such in Chinese medicine is it's a multifaceted thing to look at. So basically, they talk about this, and commonly if you look up in Chinese medicine terms, they talk about the Wei Qi field, which is like this guardian or defensive field around you. And I think that's a little bit, I want to break that down a little bit, right? So first of all, when they talk about this field, this protective thing, is basically a synonym for immunity. It really starts off with food, that builds it, right? The breaking down the digestion of food, bringing it in. So essentially the notion of things coming into the body and then the expression out of the body, right? Both on the physical level and mental emotional level, the notion bringing things in and then expressing yourself outwards and basically the top of the circle is the expression outwards, connecting to the outwards. And then at the bottom is that deep unification. You're pulling all the resources in, reorganizing them on the inside, and then functioning from there, right? So in terms of immunity, it's the digesting of foods. Appropriate foods are really, really helpful, and not just what kind of foods, but also how you are able to break down those foods and assimilate them, right? And then it's really the key piece, then part of this field, this thing of immunity, the sense of immunity, is also how you reorganize that. So you have to have this bottom component of really resting and they talk about sleep as a really core component of that, because that's where you can take those pieces of information, food, nutrition in, break it down and reorganize it, right? So we have that. Those are the key components, first of all, to have this function of immunity, right? And so then you take out the resources and they come out and express themselves in your functional and daily activity. All the way out, they think about it coming into the core of the body, right? The organs, the deep internal organs, and then coming out and expressing out more to the surface of the skin, out to the periphery of our body, our hands and feet and, toes and so on. So that it's that expression that we have, right? And how far we can express things out, that's dependent on how well we have assimilated and organized things on the other side of the circle, right? So then, if that is functioning well, that's a good immune system, right? So now the way that they look at that as well, impediments to this field, this expression outward, the surface reaction that we have is these outside factors, right? And so they talk in large part about, if you look at the classics, they do actually talk about viruses or some critters that are invisible, like living things that, come in, akin to bacteria and viruses and things of that nature. Environmental climatic factors that have an impact, right? If it's cold, if it's hot, it clearly has an impact on things. But they also talk about what's the environment that you psychologically are in. Like, is it a healthy living environment or work environment that you're in? Was it stressful, right? And all of those things, emotional, mental environment, climatic environment, as well as then, could be also, I guess, you can extend that not from just bacteria and germs and things of that nature, but also, let's say, pollutants of that kind. And so those things have to be able to, you come in contact with all of those things, right? And essentially the body has to take those in and essentially neutralize them in terms of, we think about those as movements. They impact the functional movement within our body, not just, moving up my body, but, there's a lot of activity and movements that happen internally inside the body, right? And so how well we can compensate or come back to a state of equilibrium, of homeostasis within those environmental factors, that is dependent on this field or this expression of this field as they talk about it, right? And so that's essentially the overall view of immunity in terms of Chinese medicine. right? So what can we do? What are crucial, right? Obviously, a healthy nutritional, like a healthy way of eating things is crucial. And a lot of things that we look at from that perspective is highly processed foods are obviously not very helpful because that's already an outside thing that is very hard to break down because the body has trouble recognizing what it is if it's highly processed, highly synthetic things. So we have to look at diet and nutrition. We have to look at this bottom component here of where we rest, how we sleep is really, really a key piece, right? I think it's one of the underestimated things in our time, how well we sleep and how good our sleep is, right? It's not a do we sleep, but how deep is our sleep, how well is our sleep. That's a huge factor. And then on this side of the circle is we have to consider also movement and exercise, you know? In this day and age, I just was talking to somebody who contracted COVID, and they were younger, middle-aged person, active, actually like a triathlete, so lots of running, lots of swimming, hardcore training, and so on. And when they got it, although they weren't hospitalized, they were quite miserable. They had lots of symptoms and so on. And somebody was asking me, well, why did they have so many symptoms? Well, in terms of movement, from a Chinese medicine perspective, too much movement or inappropriate movement and activities, sports and activities, can be also harmful to the immune system, right? And so we have to make sure that we get appropriate movement, not overdoing it where the body will break down, but appropriate movement that's also tailored towards the individual, right? And then, so we have to have these components. In terms of Chinese medicine and how they look at it, we obviously intervene on this side with lifestyle management. If it gets more than that, if we have to, treat it more, we use herbs to support this side of the circle. And then on this side of the circle, we use body work that includes acupuncture treatments to specifically support them. And then, of course, we also have specific, what we call the life nourishing arts that look at tools and things that you can do at home to support this whole process. And so that's where we have a lot of, Tai Chi and Qigong and things of that nature are part of the life nourishing arts because they have shown to be exceedingly supportive for immune function, for appropriate immune function. Questions?
I don't know if this is an appropriate question for this type of video, but several of the things we've been talking about, come down to unification. You haven't mentioned a lot about the separation.
Right. Okay. So yes, I've in terms of this top part of the circle, yes, it's essentially that's where they express it. So this thing on this side of the circle, which is diet and nutrition and things coming in, right, is key. And then we have the sleep and rest and reorganizational aspects of our system. We mentioned that. And then the movement outwards. We have large control with this. At the top here, this is the self-expression, the part where we connect from ourselves outwards. And this is the environmental factors of climactic things of, the psychological environment that we live and work in and so on. That is essentially that's where we make contact with that, with those aspects. And so we have to have 1, 2, 3, these 3 aspects down here basically allow that to be a healthy, supportive contact with the outside world, with what's outside of us, right? And therefore, that's why I was mentioning in terms of movement and supporting movement, it has to be appropriate. I don't prescribe my patient, everybody gets the same type of movement or exercise or thing to do, right? It's not like that. I sometimes have people, you really ought to do some dance or something like that where you have contact with other people, where you're expressing yourself with a group of people. Where others, I would say, like, what, you really ought to really focus on just stretching and a little bit of strengthening exercises and so on. It's a little bit more centered to their, to the person itself. And so we really need to approach, and sometimes I don't have them do movements. I tell them, like, what would be really good for you in terms of just immune function is, go do pottery or something like that. Go do some class, some fun thing where you connect with other people, but connect with something outside of you, right? Go do gardening or something like that. And I really try to customize and tailor the approach, the interventions, and the support that they need in order to have this proper immune function. Other questions? All right.